Have you ever rearranged your furniture and discovered the carpet underneath looks brand new while the rest of it looks, well, not so new? It's time for a carpet upgrade. At the Home Depot, we have stylish choices at simple prices from all the top brands. Best of all, we can install it for you, starting at only 49 cents per square foot. So all you have to do is pick your perfect floor. Start your carpet project today at the Home Depot. How doers get more done. Exclusions apply for licenses. See homedepot.com/license numbers.
Expedia and Visit Scotland invite you to come experience the beauty that awaits in Scotland. The sweep of wild coastlines, quiet lochs, and untamed landscapes. Fresh cuisine that feels rooted in the land. Come experience the kind of stillness that stays with you long after you leave. Plan your Scottish escape today at expedia.com/Visit Scotland.
Hey everyone, I'm here with Dr. Raj for the 5-minute care tip. Today, we're going to be talking about colon cancer screening, an important topic for all you caregivers and anyone. So I'm just going to pass this over to my friend, Dr. Raj, and what can you share with folks?
So, when it comes to colon cancer, it's just been such a hot topic. And, I want to make sure that we're not doing things the olden ways, because it was at a certain point, it was, hey, are you age 50? Do you want a colonoscopy? But really, the landscape has changed. And really, it's the young folk out there. You know what I mean? And I know caregivers are getting younger and younger. So, of course, it is unfortunate that things become popular once many famous people get colon cancer. And just recently, Catherine O'Hara, one of my favorite actresses from Beetlejuice and Home Alone and Schitt's Creek. And, she unfortunately had colorectal cancer, and one of the complications is getting a clot. And she had something called a pulmonary embolism. And then I remember, from the 80s, not giving my name, James Vanderbeek from Dawson's Creek passed away. And this really set the bar to be much, much more, aware that we need to start doing colon cancer screening in younger individuals. And most guidelines now say 45 years of age if you're at intermediate risk. And I think my teaching point for everyone today is that it's not only just a colonoscopy. You know what I mean? Of course, nothing beats doing the scope and looking at the mucosa. But I want people to know that there's stool testing that can be done. You begin checking for blood in the stool. There are things called Cologuard, and it is a brand name that checks not only for blood in the stool, but it also checks for some of the DNA, some of the cancer and polyps itself, and that can be done almost every 2 to 3 years. So there are many options out there besides just a colonoscopy, but the key thing is people are getting colon cancer at such a younger age that take away that number 50, it's going to be 45 for intermediate risk. And if you have a relative with colon cancer, it could be even earlier. So I really when I knew we were doing this episode, I just wanted to make sure I mentioned these important things.
That's important. If you had one thing to say to caregivers who have loved ones that aren't going down that road, what would you say to them?
I think the first thing that we always put aside is our own health, right? And screening, what does screening mean, Todd? It just means you're what? Asymptomatic. You know what I mean? Of course, I'm seeing blood in the stool. That's a whole different story. We don't want it to come to there. And a lot of the guidelines for age-appropriate screening for women out there, of course, breast cancer, cervical cancer, colon for both. But the fact that colon cancer, when it comes down to mortality, is increasing in younger folks, this is not right. So we have to do a better job with this.
We agree totally here, my care friends, and thank you so much for this tip for the day, Dr. Raj.
Thank you so much, everyone. Take care.